Good morning. I'm George Daly, Dean of Harvard Medical School. Sad not to be with you today, but I'm certainly with you in spirit as we mark this 8th anniversary of the Precision Medicine Conference, an event that I deeply admire for its forward-thinking approach to the customization of healthcare. My gratitude goes out to Zach Kahane, who is the chair of the HMS Department of Biomedical Informatics and assistant professor of biomedical informatics, Arjun Manray, for their masterful orchestration of this event. Now, today's conference will address some of the thorniest unanswered questions in genetic testing, an area of precision medicine that's becoming as complex as it is ubiquitous. From genome-wide risk scores to CRISPR, modern tools and technologies have enabled us to more richly characterize and treat individuals from a genetic perspective. But the use of genomic data in the clinic and, importantly, the advent of direct-to-consumer genetic testing are sounding a clarion call for scientists and physicians to develop consistent guidelines around the interpretation of genetic variants. So we have to ask ourselves, what is so-called normal genetic variation? Which variants are immediately actionable? And when is more elaborate testing required to investigate abnormalities? Can we integrate polygenic risk scores into our practice in a way that is ethical and equitable? Now, these questions and many others point to an urgent need to formalize standards for interpreting genetic variation, especially as life-changing applications of genetic technologies make their way into the clinic. If we can garner consensus on these matters, the healthcare sector will be able to keep pace with the public's demand for answers, and our clinical decision-making will dramatically improve. Our opening keynote speaker is someone who's benefited tremendously from the recent wave of advances in gene therapy. For years, tech entrepreneur Jimmy Oloher has been in and out of the hospital almost every month, and as someone living with sickle cell anemia, he often experienced severe pain episodes that required hospitalization and morphine. But in late 2019, Jimmy enrolled in a clinical trial in which scientists genetically engineering stem cells in his bone marrow, and they were able to produce a kind of hemoglobin that usually only exists in utero. Now, it was like turning back time. After undergoing chemotherapy to destroy the problematic stem cells in his marrow, Jimmy received an infusion of the freshly engineered cells. Now, as a result, his red blood cells, previously deformed into the sickle shape that's caused by diseased hemoglobin, became round and healthy again. And as soon as 2 weeks later, he felt like a new person and he was pain-free and thriving. Now, Jimmy's story is compelling, and I'm sure it will set a hopeful and empowering tone for the rest of today's conversations, including the first panel, which will focus on ways to make cutting-edge genetic technologies more available and affordable. Now, our keynote speaker immediately following lunch is Heidi Rehm, a professor of pathology at Harvard Medical School and the chief genomics officer at MGH. Heidi researches genomic medicine at the Broad Institute and has been a crusader for the development of standards for genetic variant interpretation. She's also led efforts to help deploy genomics across the healthcare system. Freudian slip there. She's a fantastic researcher and a terrific thought leader on these subjects. Now, our second panel concerns polygenic risk scores, measurements of an individual's genetic liability to a trait or disease that can incorporate many thousands of individual genetic variants. Polygenic risk scores are notorious for having built-in bias, which can affect their accuracy in some populations, resulting in compounded health disparities. Our panelists will discuss methods for generating polygenic risk scores that more reliably predict disease across populations. They'll also address the requirements for demonstrating that polygenic risk scores have clinical validity and the regulatory frameworks that would be needed to ensure responsible implementation of these services. And then finally, our last panel dives deeper into the question of what is normal versus what is pathological. While only a small percentage of the human genome is linked to disease in the form of pathogenic variation, that figure still represents a vast universe of uncertainty. What criteria for healthy individuals are optimal when interpreting variants? Is normal variation actually skewed? How should clinicians handle recontacting patients when new information turns up about a particular variant? And can artificial intelligence aid the critical work of genetic counselors? Now, as millions of people begin asking questions about the stories their genomes are telling them, our own questions within the profession beg for answers. So I wish you all a productive and enlightening conference, and I look forward to the force of your collective intellect changing the future of medicine for the better. Thank you very much.